Um, First, tell me who you are. Tell me who you are, and tell me a little bit about your background relating to health. I know that you was in Congress, but they don't know you was in Congress. I've known you a long time.
There might be some I
They might be
some.
sorry, man. But you tell them who you are and a little bit about yourself.
Well, I'm former Congresswoman Allison Schwartz,
Right.
and I represented all of Northeast Philadelphia and half of Montgomery County for 10 years here in Congress. And before that, I was a state senator, and you and I worked together quite a bit when you were in the House.
So what committee was you? What committee was you on when you was here?
Well, I was on Ways and Means.
Right.
Which congratulations, you just got on. I also got on my second term,
Right.
and I also was on budget.
Okay. Tell me, one of the things I've been talking to you a lot about is Medicare and the challenges of Medicare and people trying to enter the Medicare system. So just tell me a little bit about, if you were talking to my constituents, what's the process and what do they have to go through?
Well, first of all, there's lots to know.
Okay.
So I just start with the fact that it is going to be a little confusing and a little overwhelming.
Right.
But the work I do now with Better Medicare Alliance is we're
Right.
trying to encourage CMS, which is the government arm that works on this, is to provide simpler, straightforward information. But you should get a letter as you approach 65, 3 months before. Not a lot of
I'm gonna be 65.
Yeah, all right.
So talk to me.
Congratulations.
I'm gonna be 65 in May. So I need you
seem
to.
so happy about it.
I'm excited about being 65.
You get Medicare. So
That's what I'm saying. I need you to instruct me
Okay.
of what is going to happen with me trying to get into the Medicare system.
Okay. Well, first of all, it is a transition.
Right.
So
What's the transition?
Well, one of the things is, are you working or not working?
Right.
So first
I'm
of all,
working.
All right, you are working.
Yes.
Hard, I hope.
Yeah, very hard, believe me.
So first of all, you might want to even just go to your employer
Right.
and find out from your human resources department how they handle this.
Right.
They may or may not know the answers to the questions. They
Right.
should. But
Right.
the other is you can go and look at Medicare.gov.
Right.
You can go online and look at something called Plan Finder.
Right.
There's even something called the Coverage Wizard that can tell you about some of your options.
What is the
But
cover
basically,
wizard? What's that?
That is a way for you can say, here's who I am, here are some of my questions,
Right.
or they're like 5 simple questions,
Right.
might help you
Right.
with the next steps.
Right.
But what's most important is to know that Medicare is not completely free.
Okay.
You know, that there's Part A,
Right.
which is...
What is Part A? Right.
Part A covers hospital services.
Right.
Part B covers physician services, they call it
Right.
medical services,
Right.
other providers.
Right.
So you have to pay something for Part B.
Right.
The average cost is $132 a month, so that's not nothing.
That's if I'm working or not working.
Either way,
Mm-hmm.
okay? You don't have to purchase Part B if you have coverage.
Right. You
Now,
don't have to purchase.
If you're employed, but you cannot let there be a gap in coverage.
Right.
Because otherwise you get penalized.
Mhm.
They charge you 10% more for the rest of your life.
Right.
So you want to watch out for this.
Right.
So if you're working but don't have health coverage, you better sign up for Part B.
There's some.
But it's by income. So
Right.
if you are poor and you're on
Right.
Medicaid,
Right.
or you think you might be eligible for Medicaid, you should look into that, because
Right.
then you don't have to pay anything for Part B. Medicaid pays for it.
Right.
That's the state program.
Right. That's the state program.
Right, exactly. But otherwise, you have to check into Part B and
Right.
pay for that. Once you've done that, you're not finished. The
Okay.
letter makes you sound like you're finished. It comes
Right.
from Social Security Administration,
Right.
because they know how much you made last year, and they
Right.
can tell you how much you're going to have to pay.
Right.
Okay, but once you pay Part A and B, then you have two basic choices.
Right.
Do you want to stay with traditional? You want traditional fee-for-service Medicare,
Right.
which is where the government pays directly to doctors you go see.
Right.
It covers certain benefits, all
Right.
the benefits under
Such
one.
as what when you say certain benefits?
Oh, Medicare covers lots of benefits,
Right.
and that's a good thing. You know,
Right.
they cover. We actually made sure they covered primary care,
Right.
but there are often co-pays and deductibles, just like before you went. You know,
Right.
if you had insurance through your employer, you probably had co-pays,
Right.
deductibles. That's how much you have to pay before.
Right.
You don't have to pay anything. But then the choice is, if you stay with that, you don't have. Might want to decide that you want prescription drug coverage, Part
Right.
D. You might want to decide that you want to buy a supplemental coverage that would help you pay for some of those doctor bills.
Right.
And those have rules separately. They're actually governed by the state, believe it or not, so those
Right.
are separate. Or you could choose Medicare Advantage, which is sort of the managed care option.
Yeah, talk a little bit about that. I've heard a lot about it. Talk to me about what's the advantage of
Right.
that.
Well, it's different,
Okay.
you know, and so the best way to describe it is that some of the advantages are a lot of people find it simpler
Right.
and more affordable.
Right.
But you need to make the right decision for yourself.
Mm-hmm.
So you need to really look at the big things to think about if you're going to choose Medicare Advantage is I might be able to get more benefits because they do often cover vision care, a little bit of dental, maybe hearing screening, some other things, wellness programs, like people like silver sneakers,
Right,
you know,
right,
that kind of thing,
right.
which actually turns
I've
out-
heard about silver
Haven't
sneakers.
you? Yes,
I've
they're
seen that in my
terrific.
gym sometimes.
Yeah.
That people they exercise and stuff.
Yeah,
Right.
right. And it turns out that exercise is really
Yes,
important
it
for your
is.
health.
That's very
it turns
important.
out, you
That's
know,
very
walking
important.
on that
Yeah.
treadmill
Right,
or
right.
doing a little
Right.
dancing or you know
Right.
getting yourself
Right.
going. It
Right.
helps with balance, prevents
Right.
falls.
Right.
It helps with diabetes, helps with cardiac care, helps
Right.
with hypertension.
Right.
Sort of helps with everything.
Right.
So that's important, and
Right.
that's often free if you are on Medicare Advantage.
Right.
But you have it, you have a network of doctors.
Right.
So some people are not keen on that. They're like, well, can I keep my doctor?
Right.
So you have to make sure, you have to check to see if you can. Or do I not mind changing my doctor?
Right.
Or do I want to go to this health system but not that one?
Right.
So there are different choices.
Right.
But my own sense is you should look into your options.
Right.
It's hard. And I think to be an educated consumer is not easy. So there are people you can ask. You can ask an agent or broker. A lot of people do ask advice about that.
What about AARP and people like that?
Well, they don't really, they sell their own plans.
How do you sell their own planes? Right.
So, and I think they have both, you
Right.
know, supplemental plans and an MA plan. But the other is the government does fund area agencies on aging and something called SHIP counselors. So they're free.
Yeah, what is that?
They're free for you.
They're free?
They're state health insurance program specialists.
Right.
So they can give you advice.
Right.
They're often at your senior center in your district.
Yeah,
They're
I have a
senior
bunch of
centers.
senior centers, right.
Absolutely. I remember the one on
Yeah,
Guns
correct.
Avenue, as a matter of
Avenue.
fact.
But still, Wayne Senior Center is
That's
one.
right.
Right.
And there's one in South Philly.
One in
There's
South Philly, all
They're
throughout.
all throughout. We're lucky about it. There's one in
Right.
Germantown, or
Right.
now your district.
Right.
I used to go to all the time. You
Right.
know, there are counselors there
Right.
that you can ask for help.
Right.
And you also can call. You can call and get some more information from
Right.
Medicare. There's a 1-800 number.
Right.
And also, you should ask your family for help, or ask somebody you trust, so you can talk it out with them, or they can help you if you're not really sophisticated going online.
Right.
You gotta ask somebody else. Ask your friends and neighbors, but then you've got to decide what's right for you. What's good is, and certainly Medicare Alliance has a website called Medicare My Way,
What's that again?
and that's just for beneficiaries.
That is?
So it provides.
What's it called again?
Medicare My Way.
Okay.
So you can go online and look there. We have an open enrollment guide
Mhm.
that explains some of these things. We have some fact sheets to just say, what are your questions? Like, what's the difference between Medicare Advantage and a Medicare policy? How do I sign up? What's open enrollment? What's good to know is that you can change your mind every year.
Okay.
And so
So
if
every
you
year
get a
it comes
decision,
Yeah.
open enrollment
Yeah,
period, it's called
explain,
open.
what is this open enrollment? I've heard a lot about the open enrollment, but tell me what
Well,
exactly
you're going
is
to
a-
hear more because you
Right.
tend to get a lot of mail once
Right.
you turn 65.
Right.
Not till you do that,
Right.
but that tells you that it tries to sell you plans.
Right.
That they're marketing their plans.
Right.
But during that period, it's mid-October.
So
mid-December.
mid-October to mid-December.
Mid-December.
That's open enrollment.
It's open enrollment.
Meaning
which is
that I can switch and I can apply
That's right.
for it.
That's
So being that I won't be 65 until May 16th, that process is happening for me now?
Yeah, well, and not yet.
Okay.
You 3 months before you turn 65, and
Right.
3 months after. You have
Okay.
6 months to make these decisions.
So 3 months
The
before?
first year.
The first year, right?
That's right. But after that, every year after that,
Right.
October 15th. So if you sign up in May,
Right.
for example, you still could change your mind in
Oh, you
following
should,
year.
so if I sign up in May,
You still have open enrollment period once you're
okay,
in it.
so 3
That's
months
how it works.
afterwards
Yeah.
that I could do.
So you could do that. The thing to know is that if you go back to, you can change plans.
Right.
And that's a good thing. If you want to get out, if you want to drop your Medicare Advantage plan,
Right.
just know if you go back and into fee for service, that's easy. You
Right.
can do that.
Right.
But if you want to get a supplemental benefit that's sold by insurance companies,
Right.
they have the right, depending on what state you live in.
Okay.
As
Depends
to
on what state
you live in, because it's state rules,
Right.
as to whether you actually, they can charge you more if you have a pre-existing condition. The problem I gotta
But
tell
I
you,
thought we dealt with pre-existing conditions because we had a
we
hearing.
did on the federal level.
Okay, but talk to me a little bit
But
about.
Medigap policies are regulated by the state. So it really depends on whether Pennsylvania actually, which I don't think it's done, is actually guarantees that they will not do that, which we should change that.
We should change that.
We should change that.
I'm open for suggestions.
Exactly. So I think you should do that. You should either on the federal level, now that you're a congressman, you could say, then there's some interest in saying Medigap plans in this country have to, about half the states do it, and they have to.
Half the states do.
Have to say you can get a Medigap plan, but they can't charge you more if you have a pre-existing condition. Well, I felt very strongly in Congress about protecting people who have pre-existing.
Well, let me ask you a question. When you were making a decision, and if you was telling me to suggest, what are one or two things somebody should look for when they make a decision, which way they should go?
Well, you have to look at your health status, and what kind of
health
care.
Status,
So what kind of care you get.
Right.
Say you have a heart condition.
Right.
Do you love your cardiologist? Do you want to stay with that cardiologist or not? Are they going to be in a network or not? That's a big decision. The decisions like, do I travel a lot? Most people don't travel a lot. But if you're overseas, if you have a job that's overseas, or you're a snowbird that goes to Florida or Arizona all the time, maybe not such an issue in your district, but in some center cities there might be some folks. They might not be perfect because that might not be your network. So there's some reasons why you might not want to do Medicare Advantage, and there are other reasons you'd say, wait a minute, I like the idea of having a network. I don't really have a doctor. I would like a primary care doctor. I would like a team of people who are looking out for me, because in fact I have 3 or 4 medical conditions, and none of my doctors talk to each other. You know, I would like somebody to help me make sure I'm getting my prescriptions. The thing that's interesting about Medicare Advantage, they're able to do some innovative things. They actually can provide care in the home. In some cases, they can buy, sometimes now they might be able next year to provide transportation. They can provide some meals, possibly. But you have to check out the plan and make sure it's right for you. I wouldn't want to, for everyone, I want to make sure that they make an informed decision. We call it a Medicare Alliance, that it's being an active chooser. And it's hard. A lot of consumers have no idea.
Well, let me ask you this question. One issue I raised, from zip codes to zip codes, it changes. And there's health disparities.
There are.
To be African American, that's one age you get to be. If you're white, it's something different. So can you talk a little bit to me about the challenges regarding health disparities? And
there are challenges for health disparities. I believe that. I think there are issues in our country broadly. Healthcare is part of society. If there's discrimination, which we still believe there is, and if there are assumptions and biases that you bring to the different patterns of being a consumer. We'll talk about that as well. And the different assets. It first starts with your community. What are your assets in your community? It's you as well. What are your expectations about healthcare? What are your experiences about healthcare? If you haven't had positive experiences, you may hold back. So some of this is about the consumer, and some of it, of course, is about the system. And I think we all should be looking to address reduce health disparities, and to assure more equity in the healthcare system, as I believe we should be doing that everywhere. It's not easy to change behavior. It's not easy to change behavior of consumers. It's not easy to change behavior of providers. But I think it's on all of us to do that. I know at Better Medicare Alliance we want to push to make sure that it is being paid attention to within the system, and we can do a better job. My feeling is that Medicare Advantage is an integrated system that is able to test out new things and to see what works, and to push providers to actually work together in ways that they didn't before, or to organize healthcare systems in a way that actually can offer people more benefits. They should be able to tackle this one too.
Well, you've been on both sides. You was an elected official at the state and federal level, so you was on the policy side. Now, what it sounds like, you're on the side of implementation. It sounds like you now in a position where you're talking to the consumer about options and choices. So what's the better experience for you?
Oh my goodness, I love being in Congress. It was just a great honor. It really was. And as a member of Congress, as you know, you work on many issues. But you also, not everyone does this, but I certainly thought that it's really good to care about some in particular, and to almost create some expertise around that if you can.
So what drove you about healthcare more than
I worked in, I drove me about healthcare. I worked in healthcare before getting elected to the state senate. We worked together on getting the children's health insurance program 5 years before it came to be a federal program. I worked on women's healthcare and children's healthcare because of my experience in the city and working with the city. So healthcare's always been a part of my passion, and I ran a health center for a dozen years, and so it's something that I care about and know something about. So I decided when I came to Congress that I should care about Medicare. I mean, Interestingly, what you do in Medicare,
Right.
what you pay for,
Right.
how you organize Medicare,
Right.
makes a huge difference to everything else that
Mhm.
gets done. To people under 65 in commercial coverage, in setting an example. But one of the things I did when I was in Congress was also focus on, it's not just paying for the care, and that's huge.
Right.
Coverage is huge, that's
Right.
where it starts.
Mhm.
But how we pay providers, what do we incentivize? We incentivize more care, less care, more sophisticated care. Do we pay for that? Do we want to incentivize primary care? And I'm working on over 65, and so under 65, what about infant mortality? These are issues we should tackle.
Right.
That we should be able to, we should care about what kind of healthcare we get as well. I always cared about quality, and I cared about consumers having some choices and being able to take more control of their lives and be able to be more engaged.
Right.
So it's about, for me, I think healthcare works really well when it is well regulated, when you get guarantees about what benefits,
Right.
that it's affordable,
Right.
that's a little easier. I think we should make it simpler for people, these transitions between coverage. But that it also is being smarter, that it takes advantage of what we know works in healthcare. And that's one of the reasons I'm supporting Medicare Advantage, because I want us to be able to tackle some of these problems and then find out what works.
Right.
In government, as you know, it's hard to do that.
Right.
You can have a little program here or there, and I also think that it's working. We see over a third of Medicare beneficiaries are choosing it. More and more employers are choosing HMO coverage or managed care option because it's less expensive. We see Medicaid at the state level choosing it because if you can get people the right kind of care, maybe they don't get sicker.
Well, since you
all those
raised
things
it,
matter.
I raised this question with you. I represent
So
a
you see, I
district.
care about this. I can talk about
Well,
this
I
all
don't
day.
mind, but I represent a district with 26% poverty.
Yes.
It's been there an awful long time. It's rather frustrating
That's right.
that I see what is occurring. So the 26% poverty, the issue about health disparities, things of that nature. So if you
It's
had to
huge.
say one piece of advice to me as we try to confront this challenge of healthcare, what piece of advice would you give?
Well, I would say that healthcare has to be a part of fixing what we do.
Right.
That people can't get jobs. They
Right.
can't, be able to be all they can be without healthcare, without a sense of well-being,
Right.
and that support. It takes healthier communities.
Right.
It takes, yes, more resources, but it takes sort of reorganizing
Right.
some of what we do.
Right.
We have these fabulously wonderful hospitals in
Right.
Philadelphia, sitting in the middle
Right.
of some of these very
Right.
poor areas.
Right.
What's the healthcare like? What else could we be doing in the communities?
Right.
What else could we be doing in people's homes?
Right.
Let's go to where people are.
Mhm.
So I think for you as a member of Congress, and I know you've worked on so many
Right.
important issues,
Right.
doing something about healthcare too
Mhm.
would really be quite great.
I'd like to thank you very much for this time and opportunity
Absolutely.
that you just spoke to my constituents. And I really do. I value your service,
right.
what you have done. And I thank you for your service. I mean,
Thank you.
and I can see that you're still not giving up on your service.
No,
you're still
I'm not.
Here.
I
You're
still think I'm
listening.
doing public,
Hey.
sort of like this is about good public policy
Right.
matters in people's lives.
Right.
And that's why I love what I was doing. It's like what I love what I'm doing now.
You mean making ideas matter? Huh?
Absolutely, and bring them to work.
Thank you very much.
You're
Thank
welcome.
you very much.
Okay.
Thank you very much.